Hi, I'm Dr. Hough. While you're equilibrating, I'd like to give you a little bit more information about breast thermography, the test that we're getting ready to do, some more about breast cancer prevention, and how all that fits into a much larger picture I like to call quality longevity or anti-aging medicine. Fox News did a nice report on breast thermography, and I'll just show you that in a few minutes. First, though, let me say that cancer prevention and early detection are the real keys to winning this war on cancer. Now, the real superstar in cancer prevention is vitamin D. You can read all about that on my website, but vitamin D alone can reduce your risk of breast cancer 50 to 75%. Now, 5,000 international units of vitamin D every day would be a good place to start, and that would be my recommendation. But I can't stress enough that you get your blood levels of vitamin D checked. So get on 5,000 international units every day for a few months and then get your levels checked. Now, I mentioned that cancer prevention and early detection fit into a much bigger picture called anti-aging medicine or quality longevity. And I want to go into that in much more detail with you. But first, let's show you this Fox News report.
Hate mammograms? A lot of women do. Some doctors are offering an alternative. Instead of x-rays, they're using thermal scans to look for breast cancer.
Go ahead and put your hands on top of your head. We're going to get started. It's not painful, no radiation, safe for pregnancy.
I really like the technology.
Shira Raisin is about to undergo a breast cancer screening even though she's pregnant. She's getting checked now because
it's been about 12 months since my last.
And even though she wants a clean bill of health,
definitely don't want any exposure to x-rays.
So instead of a mammogram, she's getting a thermogram. Santa Monica family practice doctor Lauren Swerdloff is one of just a few physicians who offer them.
It's no radiation. It's completely non-invasive. You sit in front of a camera and we take pictures.
Thermographic cameras measure temperature. Some airports use them to screen travelers for fevers associated with flu and TB. But for more than 30 years, they've also been used quietly to screen for precursors to breast cancer.
They're like a thermal fingerprint.
New blood vessels associated with breast tumors can generate heat, and Swerdloff says that can be picked up on a thermogram.
A little hot spot is indicating inflammation or heat or something going on there, and it may be tumor.
No major medical organization endorses thermograms for breast cancer screening. The American Medical Association, the Academy of Obstetrics and Gynecology, and the American College of Radiology all consider thermograms investigational. Instead, they recommend annual mammograms for women over 40. But Dr. Swerdloff says it makes her uneasy.
Radiating the breast every year seems to me potentially dangerous.
A concern shared by lots of women who come to see her.
Because radiation has been known to cause certain cancers.
Denise Barrett believes she's at higher than normal risk because she's already been diagnosed with breast cancer. It was detected by her first mammogram 6 years ago. Before she had the cancer removed, she underwent a thermogram and...
well, it did pick up my cancer.
The breast tissue is hotter up in this upper outer quadrant than it is in the side. That's where her breast cancer was.
After Denise's tumor was removed...
hello, Denise.
Hi. I went back and got another thermogram, and there was no cancer.
Denise has been getting them every 6 months ever since. Her oncologist doesn't like that she's been skipping her mammograms, but Denise says she feels safer with this. As for Shira, she'll probably go back to her mammograms every other year after she's done breastfeeding her new baby. She's a physician herself, and it's what she recommends for her patients. But she won't give up her annual thermogram.
It's going to pick things up earlier than other technologies.
Dr. Swerdloff acknowledges that thermograms can show unusual heat patterns in breasts before cancer shows up on a mammogram or biopsy. Critics call that a weakness, but...
the benefit is that if you have somebody with a positive thermogram that carries a higher risk, you have the opportunity to do some other different things.
Thermography costs about $300. It is not covered by insurance. If a scan looks suspicious, Dr. Swerdloff recommends follow-up screening with a mammogram or MRI, as well as lifestyle changes to decrease overall cancer risk. No single tool can pick up every case of cancer, so Dr. Swerdloff says women at high risk are encouraged to use multiple screening methods.
Now, from the 10 News Communication Center, this is 10 News Live at 5.
Doctors have a new tool to help detect the early signs of breast cancer. When we come back, we'll have more on a non-invasive procedure to help women. New high-resolution infrared cameras are helping doctors find early breast cancers. Some physicians are using a non-invasive test that may be able to detect breast cancers in the earliest stages. You're looking at another high-tech tool to detect breast cancer. This flashing light is the key.
As far as accuracy, I have to say it's 98%.
This special digital infrared camera detects temperature changes that, in effect, make a thumbprint of the breast. It's called Therography, a 10-minute test that uses infrared imaging of the breast to detect temperature variations related to blood flow.
If you pick up something that's a 1/4 degree Celsius change, then that is reflective of something physiologically at a cellular level is happening.
While mammography relies primarily on finding the physical tumor, thermology is based on detecting increased blood flow and metabolic changes associated with a tumor's beginning and growth.
And everything looks really good. They just had a couple cells that were a little abnormal, but they're all within the duct.
Perfect.
And there isn't anything outside of the duct.
Radiologist Jean Stryker says the faster a malignant tumor grows, the more heat it generates.
Those skin changes are a reflection of what's really going on in each organ system.
This infrared imaging can zero in on a precancerous abnormality or the presence of an early tumor that's not yet large enough to be detected by physical examination, mammography, or other types of imaging.
We can pick this up years earlier.
And you're visually going to get to see your pictures as they come out.
This is Dorothy Sanders' second experience with breast thermography.
Okay?
I think this is a technology and the time has come for it.
Today, Dorothy is having a follow-up test to confirm earlier findings.
See an increased heat in this area. And
Dr. Stryker says finding this suspicious area in the earliest stages means more treatment options for Dorothy.
Thank you for telling me that, because I know that early detection, then it's highly treatable.
Dorothy says these colorful images give her the peace of mind she needs to fight breast cancer.
Apparently from this we can see that it looks good, that we can do something about it.
Studies show up to a 61% increase in survival rate when breast thermography and mammography are used together. You can find out more about thermography and the very latest information about women's health at the Head to Toe Women's Expo we were talking about just a moment ago. Once again, it's at the Del Mar Fairgrounds this weekend. Just log on to 10news.com for all the details.
Now back to this passion I have about winning the war on cancer. We can win this war on breast cancer through prevention and early detection. Of course, there's nothing that finds the signs of breast cancer sooner than breast thermography, and that's why you're here getting this test done today. The other piece of this puzzle is prevention. There are 2 million women in America today that are living with the diagnosis of breast cancer. Think if these people had employed all the strategies that we know today that can prevent breast cancer, we could have saved 1.5 million and maybe more from ever having breast cancer in the first place. That's what I call winning the war on breast cancer. I outline all of these strategies at OC Breast Wellness. I can't encourage you enough to go to that site and read this. This is right out of the medical literature, but I got to tell you about the superstar. The superstar of breast cancer prevention and cancer in general is vitamin D. Vitamin D alone can reduce your risk 50 to 75%, not only for breast cancer, but 15 other cancers as well. So I want to ask you to be a part of the answer. Just tell other people. Email your friends. Tell them about OC Breast Wellness. Tell them about vitamin D. Tell them about breast thermography. We can win this war, but it won't come from the government or the FDA or Big Pharma or the AMA. It's going to come from a grassroots effort. It's going to be one woman telling another telling another. So I beg you, please, email, tell your friends about breast cancer prevention and early detection.